Hello and welcome to the introduction on endocrine disorders. We have top 20 endocrine disorders. So endocrine disorders are medical conditions that affect the endocrine system. And this endocrine system consists of the glands that produce and release hormones. So the first and the most common disorder is diabetes type 1, which is an autoimmune disorder where the immune system attacks and destroys insulin producing beta cells in the pancreas. Diabetes type 2 is a metabolic disorder characterized by insulin resistance and inadequate insulin production. Hypothyroidism is characterized by insufficient production of thyroid hormones, the T3 and the T4, okay, by the thyroid gland, leading to various symptoms like fatigue, weight gain, and cold intolerance. Hyperthyroidism, this one is overproduction of the thyroid hormones, the T3 and T4, causing symptoms such as rapid heart rate, weight loss, and anxiety. Graves' disease also emanates from the thyroid gland and is an autoimmune disorder that leads to hyperthyroidism due to overproduction of the thyroxine and trithyro. Yes. Cushing syndrome is the sixth common condition, and we have this is characterized by excessive levels of cortisol hormone and is often caused by the endocrine gland tumors or prolonged use of corticosteroid medication. Addison disease is the seventh one. This is characterized by insufficient production of adrenal hormones, primarily cortisol and aldosterone, due to adrenal gland damage or autoimmune reaction. Polycystic ovary syndrome, we normally abbreviate it as PCOS. Okay, this is a common hormonal disorder in women characterized by irregular menstrual cycles, excessive androgen levels, and ovarian cysts. Acromegaly is the ninth one, and this is characterized by overproduction of growth hormone in adults, leading to abnormal growth bones and tissues. Pituitary adenomas is the 10th one. So these are benign tumors of the pituitary gland that can disrupt hormone production and cause various endocrine disorders. Number 11 is hyperparathyroidism, and hyperparathyroidism is excessive secretion of parath hormone. Parath hormone is produced by the parathyroid gland. So this one normally leads to elevated calcium levels in blood. Hypoparathyroidism is characterized by insufficient secretion of the PTH, that is parathyroid hormone, resulting in low calcium levels and muscle contractions. Pheochromocytoma is the 13th condition. This is a rare tumor of the adrenal gland that normally causes excessive release of adrenaline and noradrenaline, okay? Catecholamines in quotes. So this leads to hypertension and other symptoms. Hyperaldosteronism is overproduction of aldosterone hormone by the adrenal glands, and this condition leads to high blood pressure and electrolyte imbalance. Number 14 is Men's syndrome. This is multiple endocrine neoplasia syndrome. Are genetic disorders that predispose individuals to development of multiple endocrine tumors. Number 16, we have thyroid nodules. So we have this is characterized by abnormal growths or lumps in the thyroid gland, which can be benign or cancerous. Number 17 is Hashimoto's thyroiditis. This is an autoimmune condition where the immune system attacks and damages the thyroid gland, leading to hypothyroidism. Primary hypergonadism is the dysfunction of the testes in males or ovaries in females, resulting in hormone imbalance and fertility issues. Hypogonadism is insufficient production of sex hormones. So sex hormones are which one? Testosterone in males, estrogen and progesterone in females, causing sexual and reproductive problems. The last top 10 condition is adrenal insufficiency. So these are conditions where the adrenal glands do not produce enough hormones, leading to fatigue, weakness, and other symptoms. This is also commonly referred to as Addison's disease. So these are the most common endocrine disorders, but there are many others that can affect the various glands and hormones in the endocrine system. Remember, we need to have proper diagnosis and management of these conditions. So guys, remember to follow this channel to the letter, subscribe so that we can follow us as we discuss all the systems or conditions affecting the endocrine system, starting with the diabetes type 1. Thank you so much.